I now recognize Dr. Bera from California for 5 minutes of questions.
Thank you, Mr. Chairman. Couple things. As a young doctor, I did work in board and care facilities and skilled nurse facilities, and everything that you say in terms of the conditions and so forth are true. I do think we should do oversight. We should take a look at how we can protect America's seniors, protect nursing home folks, raise those standards. Mr. Chairman, I also think we've pushed billions of dollars through the American Rescue Plan, through CARES funding. I think it's worth our doing oversight on seeing how those dollars have been utilized and spent. Much of the ARP dollars were to actually improve services, ventilation, et cetera. It's worth doing oversight. So we'd love to work with you on that. I also, I'm not going to focus on looking forward. I actually want to try to understand the decisions. I'm a Californian, used to be chief medical officer in Sacramento County, and also in my time in Congress have focused on global health security, pandemic preparedness. So early on was paying attention to this. Had the first hearing in Congress and chaired that hearing on, at that time, the novel coronavirus. It wasn't lost on any of us that older patients, older individuals were much more vulnerable. Older individuals that had comorbid conditions were much more vulnerable. You saw that in early data coming out of China, but also in Italy. And for those of us in California, we saw what was happening in New York. Early on in February, March of 2020, we were already making contingency plans, working with our hospitals. For the life of me, I can't understand why anyone would take a COVID positive patient and put them in a nursing home where that's medical malpractice in my mind, and that is a decision I can't understand. There were plenty of places. We had trailers. We looked at our college campuses with the dorms and so forth, and lots of discussion of where you could isolate patients, where they could convalesce until we knew they were no longer contagious or infectious. Mr. Hammond, maybe this is a question for you. I know the New York Attorney General looked into what some of that decision-making process was. Can you share with me what the findings were?
I'm not necessarily sure what the Attorney General found, but it's been confirmed that the Greater New York Hospital Association approached the governor's office and recommended this policy. They were being pressured by the state to expand their capacity. I believe they were being told they needed to find 50% more beds. So they were supposed to convert any available space, the cafeteria, what have you. And they came back to the state and said, you could help us if you would take these patients who are stable, they've recovered, they're stable, they're still positive, and if you make the nursing homes take them from us, that will clear some space. So it was the hospital association that recommended it.
Okay, and again, just recalling some of the horrific images that we were watching in California coming out of New York, it's legitimate to think about how you free up capacity if you have really acute patients that you need in the hospital. But again, there were alternatives, right? I mean, it wasn't rocket science to say put them in the nursing home. If it was a Javits Center, if it was a hospital ship, if it was, as we were thinking about in Sacramento County, getting them into college dorms and providing support. Are you telling me that nobody is actually trying to find the answer of who made those decisions and how those decisions were made? And
I'm not aware of any investigation right now. There was at one point an investigation out of the Eastern District of New York.
Okay. I mean, Mr. Chairman, I think it's worth trying to find out if there was a federal investigation, if the FBI looked into this or others. We can't bring back your loved ones, and I'm sorry about that, or any of the loved ones, but it is important to understand how these decisions were made, who made these decisions, whether there was undue influence one way or another in those decisions. I'm not a lawyer. It's not necessarily about criminal liability, et cetera, but if we don't actually know the truth, we can't actually help you find closure and help us move forward. So, you know, all of us are elected officials, and, you know, we have responsibilities, and sometimes, you know, bad decisions are made, but we've got to try to understand why those decisions were made and help those inform us as we move forward. And again, I'm sorry about your losses, and Mr. Chairman, would love to work with you on trying to understand how these decisions were made and who made the decisions. Thank you, and I yield back.
I'm with you on that.